America has always depended on the members of its armed services to protect and defend our freedom and way of life. Now that you, our most valued citizens, are in need of assistance, the Veterans Health Administration is here to help. We want to make your interaction with the VA system as easy as possible, so we've created this video to give you the basics. Thanks for taking the time to watch it. You'll be glad you did. Before we continue, an important word of caution. Due to heightened security measures, which we're all aware of, never bring anything with you to a VA facility that wouldn't pass through airport security.
Thank you, ma'am. Have a nice day.
One of our primary jobs is to protect your rights and notify you of your responsibilities as you enter the program. These rights include privacy, respect, and the right to express your concerns about any aspect of your experience. In order for us to process your paperwork as efficiently as possible, you will need to provide all requested information. You need to treat the staff and other patients with the same respect you expect to receive. And finally, the responsibility to provide you with care is ours, but you must follow the programs suggested by your doctor. These include taking your medications, exercise, or any other instructions. Before you come in, it may be important for some of you to prepare a living will or power of attorney that would be necessary under certain medical situations. Or you may wish to be an organ donor. In any case, it's a good idea for you to discuss these issues with family members before you enter the VA.
Are you sure about number 3?
I am sure about number 3.
VA social workers are available to provide information about these topics at the time of your visit. There are VA hospitals and outpatient clinics established in many locations. Information about the clinics will be included in your packet with this video.
Hello, can you connect me to your enrollment coordinator, please?
Of course, you'll want to find out your eligibility status for VA care. And to do that, you'll want to speak with the enrollment coordinator at your nearest VA healthcare facility.
Yes, I'd like to schedule myself for a first-time visit.
First, we will need you to do a registration.
If you move to another region or state, you'll have to re-enroll in your new location. Many of you will qualify for enrollment and cost-free healthcare services based on a service-connected condition or other qualifying factor. But you should expect to be asked to fill out a financial assessment as part of the enrollment process.
I'm doing that as we speak.
Billing office, Roger, how may I help you?
The VA will bill your private insurer, if you have one, for non-service related treatments and medications. We cannot bill Medicare at this time.
Afternoon, Joe. How are you doing today?
I'm doing fine, thank you.
Good to see you.
It's nice to see you too.
Once you're enrolled, you'll be meeting with a primary care team, headed up by your primary care physician.
I see you've been trying to exercise a little more regularly. That's great.
Well, I have, but it's not easy.
Yeah, I know.
Your primary care team will provide for your health care, provide preventative health care, give you immunizations, teach you health maintenance, arrange recommended screenings, give you referrals to specialists, as well as labs, x-rays, EKGs, and other tests. Your primary care team consists of physicians, physician's assistants, nursing staff, pharmacists, dietitians, social workers, and clerical staff. They may encourage you to attend individual or family education sessions that will help you with your particular situation.
We have about 60,000 miles worth of vessels within the body itself.
We have many specialized and very informative classes that include cardiovascular, which includes topics such as high blood pressure, high cholesterol, or heart disease, diabetes education, new patient orientation, smoking cessation, weight management, stress management, anger management, and as the need arises, we add more. We also have special clinics such as women's health, cardiology, orthopedics, podiatry, lipids clinic, and diabetic clinic. You can be referred by your primary care provider to these and other specialties based on need and availability.
Good morning, Mr. Brown. How can we help you here today?
I wanted to see Dr. Harrod if I could about the medication I'm taking. I'm having a hard time sleeping at night.
That's not right.
Your primary care team nurse will be your initial contact whenever you need to ask your doctor a question, have questions about your care in general, or want to schedule an appointment with your doctor. Your first appointment with your primary care team is very important, so make sure to bring a list of all the medications you are currently taking, including over-the-counter, herbals, and supplements.
I was seen in the emergency room and they took x-rays of my wrist and they told me it wasn't broken. But it's still painful and it's still swollen ever since the discharge, and that's my concern.
Also, bring a list that has all of your medical problems, both present and past health issues.
How often do you take aspirin?
Be sure to tell your team everything that others have told you or what medications they've provided. All of this information is critical to assessing your situation. Most of the time when you call us, it will be for one of two things. You'll have a medical issue, or you'll need to schedule an appointment.
This is Go Clinic, Jackie.
Hi, I need to speak with Dr. Ling.
Whether you call the VA or our telenurse program, they will always ask for your name, the last 4 digits of your Social Security number, and a brief statement of your purpose for calling.
Hi, Mr. Rivas. What seems to be the problem today?
I think I'm having some trouble with one of my medications.
Medical calls will be taken by a nurse. If the nurse is unavailable, your call will be returned as soon as possible according to the nature of your problem. If you need to schedule an appointment, speak with the scheduling clerk. If you need to be seen before your regularly scheduled appointment, you should call your primary care team. Please check with the facility or the telecare nurse about walk-in availability. We will do everything possible to make your visit to the doctor as easy and convenient as we can. Some clinics will notify you 30 days before your appointment, so you'll have plenty of time to make necessary arrangements or changes. Sometimes, you may choose to have a private doctor care for you outside the VA system. If you do, make sure your private doctor and your VA primary care physician are fully informed of the advice and medications you are prescribed by both. The VA pharmacy only fills prescriptions from VA doctors. The reason for this is that your VA doctors are responsible for making sure that the prescriptions they prescribe for you are working properly.
The other doctor said I needed to get this prescription filled, but the VA pharmacy won't fill it.
Yes, the VA doesn't carry this particular medication, but I can give you an alternative that should work just as well.
The VA has an inventory of medications needed to treat any of your medical conditions. The drug may not be the same one your non-VA doctor prescribed, but it will work the same way for your condition. Your VA pharmacist is always available to discuss your medications and to let you know what medications are available from the VA. Some of you will be required to make co-payments for your prescriptions. The pharmacy will know the rate. There will be some paperwork to fill out to ensure you get the best prices for your prescriptions. New prescriptions can be picked up at the pharmacy, while all refills are sent by mail to your home. The My Healthy Vet website is the best way to order all your refills, or you can call the number your pharmacy has given for refills. Always request your refills at least 10 days before you run out of your medication to allow for mailing time. The outpatient clinics do not provide emergency services. If you have a medical emergency, call 911 or go to the emergency room nearest to you. The VA may pay for some out-of-system emergencies in the event you don't have other coverage, but you must notify the VA within 48 hours of your care to let them know about the emergency and your financial situation.
I fell this morning and had to go to the emergency room at the downtown hospital. I'm a veteran. What do I need to do next?
Well, you should finish your appointment up downtown. And if they
Sometimes, nursing home care is required. You would need to discuss this with the social worker or the administrative personnel at the VA facility to identify how to access the program and check your eligibility. Coverage for vision, hearing, and dental issues is limited and can be found in the Federal Benefits for Veterans and Dependents book at the www.va.gov website. A VA representative can discuss this coverage with you and answer any questions you may have. We encourage you to contact the VA regional offices for assistance with specific questions about benefits not related to medical or health care. There may be other organizations you can find within your community for assistance. They may be able to save you time and effort in clarifying your benefits or being reevaluated for compensation or pensions. Remember, social workers, clerks, and medical nursing staff are not benefits counselors. They are there to provide you with the best medical care possible. The Federal Benefits for Veterans and Dependents publication can also help you with the information about these special programs and the guidelines for eligibility. The Veterans Health Administration has about 240,000 employees, and about 50% of our male employees are veterans. Approximately 10,000 of our female employees also served in the U.S. Armed Forces. More than 7% of all VA employees are disabled veterans, and currently 3 hold the Medal of Honor. We at the Veterans Health Administration understand the special needs and concerns of you, our honored veterans. And we serve you with the same quality of care we demand for ourselves and our family members. Thank you for your time.